This video will teach you about different types of seizures and what to do if your child has a seizure. You will learn about the following: febrile seizures, infantile spasms, focal seizures, drop or atonic seizures, myoclonic seizures, absence seizures, formerly called petit mal, and generalized tonic-clonic seizures, previously known as grand mal. A febrile seizure is a seizure caused by a fever and is not considered to be epilepsy. Up to 5% of otherwise healthy children between the ages of 9 months and up to 6 years will have a seizure caused by a fever. Most febrile seizures occur within the first 24 hours of an illness. Common signs of febrile seizures often begin with a sudden cry, stiffness, followed by jerking of the body, and usually last only a couple of minutes. In this example, notice how both arms of the 1-year-old boy are raised and stiff. His eyes and head are jerking. His whole body is involved. Even though his mother is talking to him, he is unresponsive and unaware of what is going on. Infantile spasms. During infantile spasms, the infant has quick and repetitive movements which can be numerous. This 3-month-old boy is having a cluster of spasms indicated by the extension of his arms. You have to watch closely to notice the seizures, which is why infantile spasms are not easily seen. Infantile spasms occur between 2 months and 2 years of age. Appear in clusters often when waking up or falling asleep, and can be mistaken for hiccups, colic, or a bad stomach ache. Here's what to do should your child have an infantile spasm. Note how many spasms occur. Call your child's doctor immediately if you think your child is having a spasm. Focal seizures are also called partial seizures because only a portion of the brain is affected when the seizure begins. Common signs of a focal seizure include a blank stare, altered awareness or seemingly being out of sorts, repetitive behavior such as chewing or picking at clothing and mumbling. In this example, the boy's eyes are open, but he is unaware of his surroundings. He is unable to follow simple commands. Focal seizures can last a few minutes. There may be a time. Here's what to do should your child have an infantile spasm. Note how many spasms occur. Call your child's doctor immediately if you think your child is having a spasm. Focal seizures are also called partial seizures because only a portion of the brain is affected when the seizure begins. Common signs of a focal seizure include a blank stare, altered awareness or seemingly being out of sorts, repetitive behavior such as chewing or picking at clothing and mumbling. In this example, the boy's eyes are open, but he is unaware of his surroundings. He is unable to follow simple commands. Focal seizures can last a few minutes. There may be a time of confusion afterwards that can last much longer. Many children are sleepy and may not remember the event. What you should do: speak calmly and remain with your child until the seizure is over or help arrives. Do not try to hold your child during the seizure. Sometimes these seizures may progress to a more serious type of seizure, which we will discuss later. Drop seizures or atonic seizures cause a sudden loss of muscle tone. Here are common signs of atonic seizures. The child stumbles or falls, which can cause injury. The seizure may be mistaken for clumsiness or poor coordination, since the child will usually recover within minutes and be able to stand and walk again. Watch this 3-year-old boy as he stumbles and falls back in this sequence of seizures. Here, the child's head drops and he falls backward. He continues to have seizures while sitting in his mother's lap. Notice as his head drops forward, similar to that of catching oneself before a fall. Call your doctor immediately if your child has these symptoms. Some children who have atonic seizures will need to wear headgear for protection from injury. Myoclonic seizures cause a sudden jerk and usually happen in the morning. In this example, the child is having sudden jerks of his upper body as he sits at the breakfast table. Call your doctor immediately for help. Absence seizures. Watch this 7-year-old as she does her homework. While writing out her assignments, her hand suddenly stops. She looks up and briefly stares into the distance. Common symptoms of absence seizures include a blank stare that begins and ends abruptly, lasting only a few seconds. Rapid blinking and chewing are often mistaken as daydreaming or poor attention. Here is the same child at a horse show. The excitement and anxiety of the event result in a mild seizure. Notice how she steps forward briefly. She almost comes to a complete stop, then goes on to participate, unaware that she has had a seizure. While children with absence seizures frequently have trouble in school, the majority respond well to treatment with seizure medications. A large part of the brain is involved in generalized tonic-clonic seizures. Tonic means stiff and clonic means jerking. Generalized tonic-clonic seizures are the most dramatic of all seizures. They often begin with a sudden cry, a fall, rigidity or stiffness, and muscle jerks. They usually last only a couple of minutes, and the child may be irritable and sleepy for minutes to hours afterwards. This 4-year-old has lost consciousness and is stiff. Notice that his head is turned to the left and his eyes are fixed to the right. The jerking is intense and his entire body is involved. As the seizure comes to an end, you can see that the jerking is gradually slowing to a stop. Normal breathing returns and the child goes to sleep. Here is the same 4-year-old we saw having the seizure in his bed. Now happily playing, he has no memory of the seizure he had the night before. In summary, a generalized tonic-clonic seizure lasts a couple of minutes. Other symptoms include unresponsiveness, loss of consciousness, possible loss of bladder or bowel control, excessive drooling, shallow breathing, and sleepiness, confusion, or irritability after the seizure. Remember to follow these guidelines with any type of seizure. Do not put anything in the child's mouth. Do not try to hold the child's tongue. It cannot be swallowed. Do not try to give the child food or drink. Do not restrain your child. Keep in mind, your child may be susceptible to a seizure if they have a fever, illness, or infection, they are tired, overheated, or under stress, or are excited, anxious, fearful, or sleepy. If your child is prone to having seizures, keep the following in mind. Never allow the child to swim alone. Have the child take showers instead of baths, and avoid heights. If possible, videotape the seizure, as this could be helpful to your child's physician. Call your child's doctor anytime as needed.